Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 109. Some really good reasons why we need Medicare for all. I have been running across several false claims about Medicare for all recently, and I want to clarify the truth about Medicare for all. The other reason for this episode is that I am getting tired of all the false claims, and it's often necessary to refute them. Note, I will be citing studies and supporting documentation in this episode. I provide links in the description for this episode. I want to start with a really important reason why we need Medicare for all. It would save money by reducing national health care costs. Now, some people say that Medicare for all would cost more. That is false. And people often make this claim without providing any supporting evidence. So again, Medicare for all would save money, as multiple studies have shown. This article headline sums it up succinctly. 22 studies agree. Medicare for all saves money. As the above article points out, quote, every single study of 22 studies predicted that Medicare for all, would yield net savings over several years, end quote. Another quote from the article explains one major area of cost savings. Quote, Medicare for all is far less costly than our current system, largely because it reduces administrative costs. With one public plan negotiating rates with healthcare providers, billing becomes quite simple. We do away with 3/4 of the estimated $812 billion that the U.S. now spends on healthcare administration, end quote. In addition, people would get better and more comprehensive care with Medicare for all. Another way that Medicare for all would save money is by moving hospitals away from fee-for-service and to global budgets. Fee-for-service is the current way hospitals are paid. Each service has an agreed-upon fee paid to the various payers, private insurance, Medicare or Medicaid, etc. Fee-for-service has high administrative costs. With a global budget, the hospital has an agreed-upon annual budget with adjustments for unexpected high-volume or unplanned emergencies. This makes administration cheaper and simpler since the hospital does not need to bill for every procedure. Now, some people say that Medicare for all would cause hospitals to go broke. These people totally ignore this reality in our current healthcare system. As of 2019, 160 rural hospitals have closed since 2010, and more will close in the future if we keep our current healthcare system. Rural hospitals face financial stress because many patients are in public programs with lower payment rates. Global budgets would solve this problem because hospitals could be built and operated where needed, instead of being built where patients have insurance that can pay high reimbursement rates. Now, here is something that rarely gets discussed with Medicare for all. I previously mentioned that Medicare for all would lower national health care costs. In addition, Medicare for all would increase disposable income for the vast majority of households. For example, a household that made $65,000 per year would have an extra $9,750 in disposable income. This is possible because one Medicare for all financing plan would exempt the first $29,000 of income and only require an extra 4% in taxes for incomes less than $250,000. Of course, the specific amount would depend on the exact financial plan, but again, Medicare for all would increase disposable income for the vast majority of households. Another aspect of Medicare for all that is often overlooked is that it would save more than 76,000 lives per year by ending unnecessary deaths for people who can't afford health care. This number is even larger than the number of deaths from guns, 48,830. And yes, we also need to address the deaths from guns. And on a final note, please remember that Medicare for All would allow you to choose any doctor or hospital. There would be no restrictive networks. To summarize, we need Medicare for All because it would reduce national health care costs, provide better and more comprehensive care, increase disposable income for the vast majority of households, save more than 76,000 lives per year, and allow you to choose any doctor or hospital. It's way past time for Medicare for All. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.